Hi, our names are Anastasia Lukinov, Cheryl Krzmanich, Elizabeth Lasky, and Nadia Mundy, public health scholars here at the University of Maryland. Mental health amongst health professionals is often a forgotten epidemic since it is silenced by stigma in the nature of care-centered field. However, the high prevalence of burnout found in the medical field is a significant cause for concern. Burnout is defined as the physical, emotional, or mental exhaustion accompanied by decreased motivation, lowered performance, and negative attitudes toward oneself and others. It results from performing at a high level until stress and tension, especially from extreme and prolonged physical or mental exertion or overbounding workload, take their toll. In a study conducted by the NIH, it was reported that higher levels of burnout were also associated with unfavorable outcomes, patient dissatisfaction, and increased patient and family complaints. This results from emotional fatigue and depersonalization of healthcare workers, which trigger the feeling of exhaustion and cynicism, and them becoming distant and cold to their patients' needs, which compromises the quality of care.
So we recently reviewed a case study in which the burnout of nurses was observed. This case study, a sample of nurses in a large multi-site healthcare organization in Ontario, Canada, were encouraged to go into a garden to relax during their break, while another sample remained inside. Data was collected via interviews and questionnaires that were collected prior and post-intervention and then compared. The results of the study show that the nurses who were sent to the garden during their breaks had a lower rate of burnout than the nurses who did not go to the garden. As public health scholars evaluating this case study, we noticed both benefits and concerning aspects to this intervention that contributed to the reliability, effectiveness, and efficacy of the study. A definite benefit we noticed was how easy and low cost this intervention was. It has promise in being possibly a fairly low cost option that can be scaled up to implement in more locations. However, a concern that we had while reading was that the intervention did not account for the different units that the nurses worked in. Different units give different amount of stress, after all. So post-reading, we were inspired to have this podcast be about combining mental health and the health field because mental health is a common interest of ours and many of us are interested in joining the health field. So in order to get a better understanding of the direct impacts of burnout in medical professionals, we invited Jerise Asanga. She has worked in the health field for close to 2 decades now and has recently become a nurse practitioner in 2019. Thank you for joining us today.
You are welcome. Thank you for having me.
All right, so moving into the interview, Mrs. Asanga, can you please give an introduction of yourself and a brief overview of your experience in the health field?
My name is Jerise Asanga. I am an acute care nurse practitioner. I work for Bay Health Medical Center in Dover, Delaware. I have been a nurse since 2003. I don't know how many years that is from then till now, but I have worked in different sectors of nursing. I started off working in a nursing home as an LVN, and then went back to school to get an associate degree from Delaware Technical and Community College. So when I got my associate degree, I actually went into the hospital and started doing bedside nursing in the hospital. So from then, that was 2013, I moved to Texas. I worked in the ICU for 7.5 years before I became a nurse practitioner, which is currently where I'm working, Dover, Delaware.
Wow, you've definitely were able to accumulate a whole lot of experience. And you say that you currently work in Delaware. Would you mind going into your current position in the hospital in Delaware and about the daily roles that you play out?
So in Dover, Delaware, I work in an acute care facility. It's a 300-bed facility, and I am the nurse practitioner at night. The role of the nurse practitioner is diagnosis, assessment, diagnosis, and treatment. So let's say, for example, if I have a patient in the hospital who is stable or unstable, I do consult the patient and diagnose it, assess the patient. If their condition changes, write orders, and then from the orders that I write, from my assessment, I can change or modify their current treatment until discharge. The only thing I don't do is discharge patient. We let the physicians do that. So it's an extensive role. It's a little different from my previous role as a bedside nurse practitioner, whereby I worked directly with patient at the bedside. I was responsible for the patient for the 12 hours. I have a set number of patients that I was responsible for. Normally in the ICU, it's 2 patients. But now currently I'm responsible, it's a 300 bed facility, and we have 2 providers. So I'm responsible for almost everybody in the hospital if their condition changes. So it's not an easy role, let me put it that way, because you have to, it's like investigation. So you're always on your toes. When a patient starts decompensating, you have to think, investigate what could be the cause of this. Why are they sick? Why did their condition change? Is there anything that happened? From that, what do I need to do to bring them back to baseline? So currently, that's what my role as a nurse practitioner entails.
Wow, that definitely sounds like a whole lot of responsibility. And so now that you are recently a nurse practitioner, could you tell us what you would consider your most and least favorite aspects of your job?
My most favorite aspect of the job is helping patients get better. Seeing people come in at their lowest, and then when they leave with a smile, even though it's not always that way. So my least favorite is when family are going through a hard time because they lost someone. It is heartbreaking. Or when you lose a patient that you came to build um, a connection with, and then all of a sudden they are not there anymore. They die, or they just don't progress the way you want it to. It's really overwhelming sometimes and devastating, and it is emotionally draining. You have to not only are you looking at the patient, you have to look at the entire family. You have to not only care about how the patient is doing, you have to care about how the family is doing. So you have to be there for the family, especially when they lose a loved one. You have to be there for the patient. And especially when they come in, some of them come in and they don't have anybody. So you have to be that person that they can relate to or they can talk to. So it is the best and also the worst part of my job that I don't like.
Thank you so much for that very heartfelt response. You guys definitely do a lot for your patients, and I'm sure that they're very grateful to you all. And so, moving on to the next question here, how would you describe your work environment? And so, based like going from that question we asked, like, what do you believe is the most stressful aspect of your job?
The most stressful aspect of my job is the emotional feelings that you develop. It is very fast paced. It is emotionally draining, physically draining, and I mean, it's you because you have to have compassion to be able to work with people, and having compassion entails some emotional investment. As a nurse, every day I go into the hospital, at least there's 1 or 2 situations where I have to be emotionally supportive to the family. I have to hold back my emotions. And sometimes, a lot of times, not even sometimes, most times you have to hold back tears when you encounter certain situations. So it is very emotionally and mentally draining when you work in the hospital. So in that light, that's why I always say you have to love what you do to work in that environment.
Well, yes, that's definitely something that we as college students can take away, that we have to love what we do. And thank you very much for that answer. And so, as a nurse practitioner that has several years of experience in the field, have you ever witnessed a situation where the mental health of a colleague or even yourself was disregarded in order to prioritize a patient?
It's not only me. Every nurse, every day we step into our work environment, we need the support. And I think that a lot of times management or most hospitals, let me not say management, most hospitals do not invest in the mental well-being of the nurses at the bedside or the providers at the bedside. We have a support system. We need to have a support system, somebody that you can go talk to when you encounter a problem, somebody that can be there, that you can reach out to. So I say this because we've sat in a break room a lot of times, and I have been in tears countless times. My colleagues have been in tears countless times, and sometimes you just don't know what to do. You go home feeling terrible. I've gone home devastated and can't even eat or drink. I get home, take a shower, and just lay in bed, hungry, but I don't, because of the situations that I encounter at work, but I don't have that support in that environment to say, hey, I need you, I need to talk to you, come here and distress. Let's talk about this. How are you feeling about the situation yesterday? I mean, if you are a human, during the COVID, in the height of the COVID, I had 4 patients. 4 patients died on me. And some of these patients had been there for months. They came in walking. I built a relationship with them. It emotionally drains you. And I go home and I ask myself sometimes, is this what I want to do for the rest of my life, feeling like this? And if management in hospitals could invest in the mental well-being, do activities that kind of create that supportive, how do I put it, provision for the nurses, I think that will help greatly. And normally, if you guys don't know, the normal turnover rate in an ICU is 2 years, and it is highly because of burnout. We get burned out easily. You mentally start thinking, no, you get stressed, you get anxiety, you get depressed. I mean, we talk about it as if it's a joke, but a lot of ICU nurses will tell you, since I started working here, I've been on antidepressants. Since I started working here, I have to take an anxiety pill. So it's not an easy environment. Working in the hospital is not an easy environment to work in. So in the healthcare field, we need provision to take care of the mental well-being of the nurses.
It's definitely terrible that you guys have to be under so much pressure. And I think that COVID-19 has really opened the discussion that medical health professionals are not, their mental health is not being prioritized. And we're very sorry that you and your colleagues have to go under so much. And so you said that the hospitals, they don't necessarily prioritize your mental health, but you guys continue to push every single day and you continue to go back to work. So what are some ways that you decompress from the stress that you guys have to face daily?
To decompress from the stress, you have to have a strong, support outside of the hospital. You have to have a strong support system. Like I said, when I go home, Nadia, when I come, every time I come, we have a family gathering. That is where I get my energy from. The family support that I have and my love for people is what gets me going. Because outside of the hospital, sometimes I'll talk, if I call a family member and I talk. So the support we have in the society, church is very supportive. I mean, having fun with family and friends, going out for dinner, going out for maybe just a walk and stuff like that. That kind of helps. That kind of helps bring you back to the center. During the COVID, I got my strength from, I started watching Asian dramas. That's where I got my strength from, because that that puts me in a different world other than what I'm facing. So I kind of got hooked watching Asian dramas from that. So it's the support out of the hospital. You have to find a way to have that stability out of the hospital, because if you don't have that stability, you're going to have a very hard time working in the hospital. You might have a mental breakdown.
Very glad to hear that you have an emotional support system that helps to keep you running. And so, does your workplace provide an outlet for employees to de-stress even a little bit? An example from the case study we reviewed is that a hospital provided a garden for employees to spend their breaks.
Yes, the hospital, I think last year in the hospital, we had a meditation room that we kind of instituted a meditation room where you go in there. It's really quiet. The lights are down. You have like scented oils, and you just sit there for like 10 minutes and distress. Or if you feel like you need to get away, you can go in there and just sit there for a couple of minutes. And also, I think when I left, before I left Texas, in Delaware, I don't think we have that provision. I think we have a number you have to call, and it's even more stressful when you don't have, like, let's say the chaplain. When somebody dies, you have to be the one to break the news. I think that provision is not, I'm not sure of what is available in Delaware, but I don't think that is available. But right before I left Texas, there was the provision of the meditation room to distress. And then the chaplain came around, do you need anything? Are you okay? And sometimes that's all you need, somebody to ask you if you're okay. That is lacking a lot. There is not a lot of the provision for distressing in the work environment.
It's kind of sad to hear that there's no resources readily available to nurses. So how do you and your coworkers deal with loss? What techniques or skills do you use to deal with that? You talked about losing a patient during COVID, and that was hard. How did you deal with that during that time?
Working in a hospital, you have to work as a team. So sometimes we get around and talk about it. I mean, not officially. We just talk to somebody you feel like it's a friend. You just talk about, oh, my patient died, and oh, why you don't look too good? What's going on? And that is if somebody knows you enough to recognize that you are not having the best time today. That's why I said this. Among colleagues, we kind of talk about it amongst ourselves. But and like I said, that can also be challenging given the fact that there's a high turnover in the hospitals. Like I said, the average turnover, average nurse stay in the ICU, which is where I predominantly work, is 2 years. And some days you go to work and you look around, you don't even know anybody. And so you have to deal with your own emotions because you don't know A, you don't know B, and you have to be comfortable with somebody to be able to open up how you feel, open up about how you feel to them. So normally we talk about it amongst ourselves, and so you just have to deal with the emotions and talk about it to somebody outside of work.
And are there ways like you can identify like if a coworker isn't doing so well or their mental health is declining, and like what signs are there to like recognize that, and like what do you do when you recognize that?
If I normally, if you work with somebody for so long, you kind of know their behavior. Sometimes their behavior would tell, just looking at them in the face would tell you. And I mean, it doesn't really gives you all the hints, but some of them are good at expressing their emotions, and some of them you just won't tell. But usually it's the coworkers that will pick up somebody that is not doing so well, because it's like, are you okay? You don't look so good today. And they're like, oh yeah, yesterday I kind of, this happened or this happened. So you only know if you ask, which is why I make it a point, like, to always ask my coworkers, are you okay? And a lot of times you ask, are you okay? And somebody bursts out in tears because they are not okay, but they just could not. Nobody's asked them if they are okay, or they just haven't had the avenue to vent or discuss what's going on with them, be it personal or be it related to work.
And is there someone like a management position or someone who's like keeps track of all the nurses on that floor to keep tabs on everyone, make sure they're okay, or is it just really up to like individuals and each other's coworkers and stuff?
Let me say that I think yeah, normally your manager is supposed to keep tabs with you, make sure you do your job right. But a lot of times I think management is more focused on getting the job done rather than how are the people who are getting the job done doing. I can go to work for 3 weeks and not see my manager. So within those 3 weeks, if I'm not okay, there's no way she's gonna know that I'm not okay. Especially if you work in an environment where you have like so many nurses. Oh, and then the next time you say, oh, I haven't seen you in a while. How are you doing? I'm doing good. So I don't think, I think management, they do have people. The management is there, but management, they have their own duties. And I don't think one of their duties is, I think they mostly focus on, is the job getting done, or is it getting done right, as opposed to, is the person who's doing the job okay?
Wow, thank you so much for your perspective into the health field. I think I can say for everyone that you've definitely taught us a lot about the inner workings of hospitals and other healthcare facilities. But now we come to the end of our interview section, and we just want to thank you once again, Mrs. Asanga, for joining us today and helping with our podcast. This has been a fascinating discussion on mental health and an insightful look into the health field. And to our audience, as you've heard here, burnout can be a serious problem for both patients and the health of those working in the health field. We went through what burnout is, a case study about one possible intervention to decrease burnout in nurses, and an interview with Mrs. Asanga, a veteran health professional working directly in the health field. Thank you for your time, and we hope everyone has a great day.